A very good evening to all the listeners of Rehabilitation Science Group. Like every time, we are bringing a very innovative topic today in the field of rehabilitation and physiotherapy. Today, we will be discussing about the introduction to ANF. We have with us Dr. Akshay Arora, who is a physiotherapist and by qualification is MSc from United Kingdom in advancing physiotherapy practice and is also the ANF holistic therapy from Spain. Akshay is also the founder and head physiotherapist at Health Pro Solutions. We welcome you, Akshay, and I hope it will be an interactive and a very informative session.
Thank you very much, Dr. Harpreet. It's a pleasure being here. So we're going to start on introduction with ANF therapy today. It stands for Amino Neurofrequency therapy. So this therapy is based as headquarters in Spain, and it's been invented by the inventor. His name is Dr. Michael H. Hoff. So I'm a holistic therapist. So this course comprises in different levels as you want to grow into it. And I'm going to go into introduction of the therapy, and then we're going to talk about if you want to bring this practice in this therapy into your practice, then how you can do it and how things can move on further. Before that, I'm going to give you a little bit background about how I got into it, and then we're going to go on to the introduction. Yeah. So about in 2017, I got to know about this therapy through the internet, and I was heading W. Pratiksha Hospital then, and I was seeing a lot of cases from all departments, from neurology, orthopedics, sports, and it was very intriguing. And there was a time when there are cases which are very sometimes get very tricky, and patients do not get as much good results as we expect. So I started looking into a therapy where I can help my clients more better with more, taking not much time and, getting them to reach their goals as soon as possible. So I looked upon on the internet, and I found Dr. Mikkel's video, and I decided, okay, I'm gonna do this course, and rest is all history. So I've completed all 8 levels of ANF, and now I'm the instructor and ambassador for this therapy, and I handle all India for this. And it's such a pleasure to be on this group today and share my experience and spread this information and a lot of more detail about ANF today. Yeah. So let's start it now. I'm gonna just share a file with you, and then we're gonna start. Okay, so ANF is Amino Neurofrequency therapy. It is a therapy which involves uses of frequency to optimize signal of the nervous system by restoring the normal biochemical reactions in the cell. As a result, symptoms such as pain and inflammation decrease and bodily function normalize. Now, what does that mean? This means, I will give you a very simple example. Yeah. So we know the heart is contracting and relaxing. Yes. Now, my question to you is, how does it contract and relax? Any guesses? Yeah. Okay. So how does this contract and relax is because of the current. Yeah. Current which is running in the body. And where there is current, there is frequency. Yeah. So wherever there is frequency, that means the heart has its own frequency, where it is a normal frequency on what and how the heart functions, right? Now, similarly, if I talk about the liver, now if just because the liver does not contract and relax, that doesn't mean that it does not have its own frequency. Yeah. And so as your kidneys, so as your spleen, so as your nervous system in terms of every nerve. Yeah. So what is happening here? So all these frequencies are already set in the body, and these coordination of these frequencies and the whole amalgam runs the whole body in a healthy way. Yeah. So this frequency medicine, this therapy is also comes from the frequency medicine, and it is very innovative therapy. Why? Because it normalizes that frequency of different parts of the body or organ functions. Not just normalizes, it helps it to work in synchronization with each other. That is why it is restoring the normal biochemical reactions in the cell. The best part of this therapy is actually it starts working in first 15 to 20 minutes of application. So no matter if your pain levels are from, is like a chronic pain for 10 years, 20 years, the pain and inflammation levels will start to decrease in first 15 to 20 minutes. And the reason being, because it works on your neurons. Yeah. So your nerve, for example, has a definite frequency. And if that frequency is not optimal, like we have seen, with a lot of people talking about, oh, there's an irritation to the sciatic nerve. Yes. And what does that mean? What is that irritation? It's not just that, okay, piriformis is, gone tight and it is impinging and all of that. Yes, true. But then it's the nerve itself at times where its frequency, where it should run on, is not optimal. And when the nerve is not functioning optimal, what would happen? Inflammation. And that's how this therapy works, that there is this disc that what we use here. It is called the Anf disc. I'm going to just show you. So it is very simple in terms of how it looks. Yeah. So this disc has a carbonized metal which can emit frequencies. This frequencies is to normalize function of the body, and it gets activated by the body's heat. Yeah. So when we work on this, we try and see of where the problem, the source of the issue is. So ANF therapy, when it teaches the participants, what they teach is actually, first thing is to find the source of the issue. So it is a very specialized assessment based on palpation skills, and through those palpation skills and detailed assessment, we try and find the source of the issue of where the problem lies. Based on that problem, when we have identified the problem, we make a protocol that where the discs and what discs should be applied. And then after the application, we apply the discs and we retest. So we do a pre-test, do the assessment, everything, apply the discs, and do a post-test. Yeah, that is why this therapy is quite amazing in terms of how the results can be produced. Yeah. Also, it's as you can see, ANF therapy builds on extensive and integrated knowledge of human anatomy, physiology, biochemistry, and neuroscience. It is a drug-free and combines holistic medical framework with use of advanced wearable medical device, which is the ANF disc. Yeah. So these discs are FDA approved, CE marked. So there is no chemical, no pharmaceutical or anything inside the discs. So all it has is a carbonized metal which can emit frequencies. So this is something which is quite very new, and I know it is quite very different from what we have seen. But this special characteristic of this metal, of how it can emit frequency, is helping the normalizing function of the body. Yeah. So if we look at the screen here and we see how does ANF work, it's emitting frequencies applied directly on the skin, activated by the body's heat, transmits a unique frequency. So wherever the nerve or inflammation resides, you put on the disc and the inflammation would start to reduce in first 15 minutes of application. The nervous system picks up these frequencies, starting with self-healing, self-regulating process and improving the nervous system, signaling it directly to the cellular level. That is why it is very fast when you apply the discs and the results are produced. The effect of the treatment is immediate, yes, and has remarkable durable results. ANF does not require the use of any drugs, chemicals, or machines. All you have to do is palpate and do a proper assessment to find the source. You have different frequencies as a tool of what is required, where and when. and then you get results straight away. Yeah. So as personally, I would like to share that I've personally never seen anything like this before. Since I've started using this therapy, I've helped a lot of my clients, and where I was getting stuck with patients and where nothing was helping, this ANF has done amazing job. And I've seen up to an extent where it works very holistically. So it's not just about musculoskeletal issues or neurology. It goes into viscera, it goes into emotions, mental disorders, and anything and everything where inflammation resides. Yeah. So my question to you is, if I give you an example, as if somebody has an injury, as musculoskeletal injury, what is the first response? Is where inflammation starts to occur. Yes. So everything starts with inflammation. Now, if you take a bigger problem or a disease, let's say cancer, so does it grow overnight? Answer is no. So where does it start? That also starts with a cell and inflammation. That's why this therapy is very strong, because it starts working with not just pain but also inflammation. It reduces inflammation to a point where the self-healing of the body starts to occur. Now you must all be thinking, okay, it is self-healing and everything. What if this let's say, for example, a heart rate which is going into increased heart rate, yeah, tachycardia, and we think, if we put this frequency, will it increase it more? Answer is no. Why? Because it is always normalizing function of the body. So the frequency is, if the heart rate is going lower than the usual as the normal, it will normalize. Whereas even if it is going higher, it will still normalize. Also, as I said, it is all is carbonized metal in the disc, so it has zero side effects whatsoever. I'm going to go on to more details of it in a bit, but I just wanted to cover all of this just now. Okay, I'm going to upload another file with you where, like you can see, and I totally agree with this. This is by far the fastest improvement that I have also ever witnessed in my practice in last 11-12 years, and it's just amazing of how this therapy works. So it has very vast reach of what patients it can treat, but anything with what you see on the screen, looking into pain, back pain, sciatica, stomach and intestine problems, inflammation, migraine, headaches, and all of these, even skin problems, and all of these issues, what ANF can help with. ANF never uses the word is cure, because it always uses the word called normalizing function of the body. Also, if you must be thinking, as I'm assuming there are a lot of physical therapists here in the group who are watching this, so you must be wondering, oh, there's stomach and intestine problems, skin problems, and how ANF therapy is going to come in, how we would know what to use and when. And all of this is very categorized into different levels of ANF, which I'm going to explain you in a while. So even when we do starting levels of level 1 and 2 in the practical training on hands-on techniques, in assessment, we show off how you find inflammation in the gut area, and then how you can help reduce inflammation to help these clients with intestinal problems also. Okay. So like I said, we observe on a daily basis that ANF therapy clients notice significant pain reduction already in not just, like I said, 15 minutes, but also within 5 to 20 minutes. Yeah. So it's quite interesting of how this therapy works. And also, like I explained you before, that this therapy addresses what is looking at addressing the root cause of the pain without the use of the drugs. Yeah. So this is something where I find very interesting, because it does not have any side effects, and it works on the source of the issue. So it's not about providing the pain relief for a very short while, but looking at the bigger picture and helping clients recover completely. So what is the aim of this therapy is to enhance body's ability to heal itself, normalize your body's function and systems as quickly as possible, reduce pain and inflammation, increase your energy level and overall well-being. Okay. So you must have heard about invisible inflammation, right? And what is this invisible inflammation? So if you think about it, like a lot of people would have some sort of rashes on the skin, yeah, or they would always have this sort of cold or cough going on as a symptom, always with weather change and these things happening, right? You will always also see some brittle nails. Also, you will see some. So all of these signs are signs of invisible inflammation, yeah. So this invisible inflammation is what? That is the toxicity in the body, right? So whenever there is toxicity coming in the body, where does it coming from? Yeah, like for example, even the oxygen that we breathe, right? So not everything gets absorbed, right? So there is some toxicity which is released there. And what is it is paired with is called antioxidants in the body, right? Now, if your antioxidants in the body, as much as they are pairing with the toxicity, as the toxicity would increase more, and the function of these antioxidants are not working as much, what would happen? Increase in inflammation. And what is this inflammation increasing is doing? Is leading to pain and problems. Can be anything with neurological or as more affecting and more in different systems of the body is lymphatics also. Like lymphatic is very much is like the cleaning system of the body, right? It's responsible for removing toxicity. And when lymphatic insufficiency happens, where the function is not proper, then all of these inflammations and diseases would start to reside in. And this can also is not related to just very much of small problems, but not if not taken care of, it lead to major issues. And why I'm talking about invisible inflammation here? Because ANF therapy in its assessment helps you to assess and get hold of these invisible inflammations by palpation. So you palpate into the deep tissue layer, palpate into the organs and find inflammation, and then you have a tool which can help you to reduce that pain and inflammation and help people to go back to their healthier living. So it is possible to see inflammation, and then how to reduce it is through ANF therapist when he examines your body. And examination can be painful because when you press onto an inflamed area. So let me come back to as an example of when as a therapist, when we palpate a tissue layer, we go into a deep muscle and we see the patient wincing with pain and say, oh, it's a lot of pain, I cannot bear it. And how many times we are thinking that, okay, I find a trigger point in the muscle, or I feel that the muscle is very tight and all of that, but how it's sometimes it's very unexplainable of how patient is jumping off the couch, right? And that's not just about a trigger point, or it's not just about a muscle tightness. It goes more above that, growing into an inflammation in the body. And that inflammation is when it grows into more and more problems, that becomes chronic and starts to affect all other systems in the body. And that is why this therapy is not just working temporarily, but more into the source of the issue, finding the problem and helping them to normalize function. Okay, these are this therapy is being used all over the world now, and you'll find different instructors and helping this therapy to grow in every other country and doing amazing. So what is another thing which is important here is that yes, it gives a quick result, but what is also important here is that you need to drink a lot of water. So this is very important, that you need about 1 to 2 glasses of water per hour, so that water is conduction for this therapy. So for the frequency to transfer it to the next neuron, you need to hydrate, so that the hydration is helping the frequency to, have good connections and provide a lot of quick relief. So also, if you're having any tea, coffee, beer, or wine, you always need to add an extra glass of water. So keep yourself hydrated, and always helps. These are some treatment goals of how ANF therapy works in 4 phases. So the first treatment is applying the ANF disc in order to address inflammation, so to reduce pain as quickly as possible. So when the patient receives this treatment, it has 0 side effects whatsoever. Why? Because, like I said, it does not have any chemical, no pharmaceutical or any other thing inside except a carbonized metal. So when this is applied on the client and the frequency starts to normalize, it is quite possible that in the initial phase, when patient is not so used to it, they start feeling some detox symptoms. Now, when I say detox symptoms, that is only symptoms. Yeah. During the initial phase, clients experience some detox symptoms that can be very uncomfortable. But it is a positive sign, and it indicates that the therapy is actually working to heal. I'm going to go more on the detox symptoms, but what you need to know is that it has 0 side effects whatsoever, and it might have some detox symptoms, which is actually a very positive sign. Yeah. After removing and working on the inflammation, the second stage, which is the phase 2, is called the in-depth focus phase. Yeah. Here you see the most common and the serious inflammation show significant improvements, and the number of patches, the number of discs what we have used in the phase 1 would start to reduce. Yeah. The focus will be now on in-depth treatment of the problem. And you might experience in patient that the pain is shifting and they have some discomfort somewhere else. And most of you know why, and we see it all the time. When we treat a client and their primary symptom resolves, and they suddenly say, "Oh, now I start feeling in the shoulder where I was feeling back before in the neck only." Yeah. So why does that happen? Because the body and the mind is able to perceive only the most acute pain at any given point in time. So all of that keeps changing otherwise, and that is why this therapy would give you as a good sign that, okay, yes, if that is happening, it is quite a possibility that the treatment is really working very good. Yeah. The third is the regeneration phase, where the inflammation is removed now, and you work on regenerating those muscle tissues or any other tissues per se when we're using ANF therapy. You'll be guided how to best train in affected areas and in the entire body, and listen to your body and do not overexert. Now, what happens usually in this phase 3, as patients who start to feel quite amazing, all of that chronic pain is gone, the inflammation is much less and almost removed there, and they would start going back into the gym and say, okay, I'm going to train nicely. I don't have pain now after so many years, and I'm going to do the best what I can. And that's where we tell our clients, okay, it's the regeneration phase, and you have to allow the body to regenerate and don't go back into making it inflame again. And then the phase 4 is the maintenance phase, of course, where the injury treatment ends as you have no pain and affected areas. And here you choose how you can choose to support your immune system, reduce the risk of injuries. Don't make the mistakes of what you have done in the past. And now it's good time to train and make your body more healthy and balanced. Yeah. Good. Okay. So this explains you how your body is to benefit from the therapy, like I was just explaining you. And it says about you should avoid a little sugar, because sugar is increasing inflammation in the body. You have to get a good sleep to help the body recover faster, have a good diet, limit alcohol if you can, and this may reduce the disc effectiveness if you're taking alcohol and all of that. Yes. So how long this therapy is how long should I be treated? Like how long is this therapy treatment is there? So anything from a month to 4 months, and it can go up to 6 months, depending on what problems are there, and depends on assessment, of course. But as an idea, about anything between a month to 4 months is a good time, as ANF is treated, and it can go up to 6 months also. Usually we start seeing a patient each week to start with, and then as we know and understand patient's body, and so we start using this therapy after every 15 days, and then 20 days, and so on, so that we are helping our clients. And after a while, we can also give a protocol and the discs for clients to take home, because if you will see, these discs are very easy to put on. Yeah, so you can just remove a disc from it. It is an adhesive tape, and we give this to clients and tell them where to put on themselves, and they have no problems using it. So it's a great tool, and which they can use on their own, and they're very happy doing that. So it's very good. Okay. Yeah, so we were discussing about detox symptoms. Like I said, the therapy has zero side effects. All it can feel is sometimes headache, dry mouth, dizziness, light flu symptoms, fatigue, some discomfort, running nose, some skin problems like an itchiness or something. But these, like I said, is all good, because that means your body is eliminating those waste products, and that is why you have the detox symptoms. Yeah, and it is a good sign that body is recovering. But you must be thinking, oh, what if the patient gets a little bit worried about these detox symptoms and does not understand? Then you explain the patient that the process is important for the body to function, but you can always interrupt the detox symptoms by taking the discs off. As I showed you, it is like an adhesive tape, so you can always remove the discs and rest for a while till your detox symptoms subsides, and you can always put the discs back on. So it's very good that way. Yeah, like I explained you before, the pain might shift here and there, and this is the body's healing affected areas where they normalize and all of that. Yes. Now you must be wondering, what is this disc is about? How is that this disc is so amazing that it can give results in first 15 minutes of application? So now this is from the old information. So there are now above 200 different discs which are there, which have the unique specification and function. Of course, I mentioned that this is CE registered and FDA licensed, and is totally non-invasive as you put it up on the skin. It works up to 72 hours. Once you apply the disc on, it stays on the client for 72 hours. That means that it is on for 3 days. So once the treatment application is on, the patient is getting this treatment for next 3 days continuously, whether it be today or night. And that is why this is actually making that change to help patients to heal and recover. Yeah. Like I said, we can normalize and optimize body functions, nerves, muscles, lymphatic system, and hormonal production also. So you must be thinking, what hormonal function is how? Now, if I tell you that your pituitary gland has a specific frequency it runs on, and we have a specific frequency disc called the pituitary function. Yeah. So you apply that disc on pituitary, and the pituitary would start to work at its optimal function. And that's how you can help people with hormonal imbalances with ANF also. Yeah, pretty amazing. Yes. Good. Okay. Good. So I'm hoping everything is clear. I've explained you it's a carbonized metal. The disc only is normalizing function of the body, and its disc do not contain or release any substance which can harm the body. That is why it is completely safe to use, and you can use it with people with pacemakers on, having been surgery done and all of that also, no problems. Okay. So a lot of, like I explained to you, this therapy can be used for anything which is with pain and inflammation. The instruction as we give is always clean the skin and put it on dry skin where there's no body cream or anything which is applied before. This is a 3M antibacterial tape. So this is the tape which is being used in surgeries also. So there's hardly any chance of infections or anything which is there. Activates by the body heat, and you can gently just slightly massage the concerned area before applying the discs. So it sticks on nicely. When removing the disc, please do it slowly to avoid pain and skin irritation. Yeah. Okay. Sorry. So we move forward. Just give me 1 second. Stuck here. Okay. Good. So this is CA registered 3M tape, does not contain any organic substance. It is very easy to store these discs. This is called the anti-static bag. So you always put the discs into these bags, where these anti-static bags make sure that there is no problems for other frequencies to interfere. And be aware with that the scanners such as the security ones at the airport utilize the frequency if discs are not stored. So that is why we say while you go into securities in airports or scanners, you should always keep the disc in anti-static bags. Yeah. Good. So you must be thinking how much this therapy costs and everything. Yes. So this therapy, when we use this one disc, one application on the one disc, which in India is charged at 320 rupees. Normally, this disc is all as the same price all over the world. So in the Europe, it's about €4. In US, is $5. In India, is 320 rupees. And this therapy is used when we assess the patient and then we get to know about how many discs we would need in for a total therapy cost, but as a piece it costs about 320 rupees in India. Yeah. Good. So there you go. I'm gonna go off here. Okay. So, pretty interesting of what we have done here, right? Yeah, this is very different from what we have seen before. So how this therapy, as if you want to get into in your clinics and healthcare centers, of if you want to get this tool into your practice, how you can do it. So I'm going to just be very brief about it and just go on with it. This is a theoretical insight that is being done in this course. So we do an online program for course 1 and 2. And after that, there is a practical training which goes on. And with practical training, we show you everything with hands-on techniques. And we get test patients into the program, and you can get your own test patients also. And we do the treatment, ANF treatment on them, and see results accordingly. So we go into a theoretical insight first with this online sessions. So we do this online, and we spend time with course 1 online and course 2 online. And then we do the practical training of 1 and 2 together, which is in person. So we do the theoretical insight, we do the practical training and ANF disc treatment when we do the practical training, of course. We also do the ANF disc treatment while we're doing the online sessions also, which I'm going to show you now. So this is an online program which would go into methodology of the course, what frequencies, patient information. We do the palpation also online of whatever, and how we will explain through some videos and so on. And if you look at this as block 4, there is this self-implementation and online test, which is the guided test patient also. So block 4 would involve that you can bring your test patient in the online thing, and I'm going to guide you online, and you can apply those discs. So there will be discs which will be sent to you from Spain directly to your clinic, and you can then use these discs online, and I'm going to guide you alongside. This is part of course 1 itself. Yeah. Then there's course 2, we do online again, and then you do some master classes based on the basic, going into the in-depth knowledge of this part. and we do the master classes of phases of treatment, lymphatic and energy. And then we do the course 3 online also. It has now come online, and then we do the practical training part of it. Okay. These are some discs, and also what I will do is we will send this whole thing information on the description of the video, so you can always go back and have a detailed look on it. So if you will see, you will do online course 1, and then you do 2. You do some master classes in between, and then you do a practical attendance, which is 2 days, here, practical training. And we set up different courses to do it, and we do it at different states in the country also. So that's how. So if you're looking for anything like this to add on to as a tool into your practice, then you can always opt for it. And like I explained you, there are different levels as level 4, level 5, 6, level 7, level 8, and then you can also have a chance to be an instructor like me, and you can do that after course 4 anyway, as instructor training. So you can have a chance to be an instructor in this therapy, depending on how good and quickly, and how good you grow this therapy with your clients and nicely. After you have done level 1, 2, and 3, you will be certified from Spain as a pain therapist. And once you have done level 8, which is only in Spain, and you get certified as holistic practitioner. So I am a holistic practitioner, as I've done all 8 levels of this therapy. And now I'm also instructor for level 1, 2, and level 3 and 4 as well. So it's quite amazing of how this course is very detailed, and it works on international standards with exam, a small exam after every level, and making sure that the quality and everything is standard worldwide, and it's maintained worldwide to help our clients and everything in that regard. Good. So last bit, what all is like that. So I'm just going to show you. So these are some practical training courses here. This is online courses. We have students all around the world. So we have people like from Europe, we have people from Middle East who can sign up in the online program also. And for practical training, they can always go to their instructor who's their country instructor, or if they want to travel. And then so when we do online stuff, we do different areas, like we have done in Bangalore also with ANF. We do online and all of this also. If you're looking to add this into your clinic, or you are not sure and you would like to go into some sort of more understanding, then I'm always available on to this. So you can always take a screenshot, or the details where to contact. You would like to introduce a demo into your clinic or a rehab center first, you're most welcome, and you can just always contact me. If you want to learn this therapy, you can just get in touch. Yeah. Just before I finish, the last thing is I thought I'll just give you a little preview of how we do things as a demo. So this is I was called upon as a demo to a lot of places before. So this is one of the same, is from GT Goenka University. So I gave a demo there. So I'm just going to play a video, quick video, just 1-2 minutes, just so that you have an idea of how simple this therapy is, and how effective, and how quickly it just works. Yeah, this is a pre-test. So I'm going to just go where I'm going to check his flexion here, so you can see how much the shoulder goes back.
Dr. Akshay, the video is not visible.
Okay. Sure. So I'm gonna try another thing. So just give me 1 second, and we're gonna start this. Okay. Okay. So where we see the flexion of the shoulder this is pre-test, or This was post test. Here.
I apply the disc.
So you see I'm going to go on the flexion. This is where the flexion is. This is how much he can go. Yeah, this is the maximum.
Okay.
This is the external rotation. This is the maximum he's able to go, and I'm really pushing it hard. Yeah, as much as I can. This is the internal rotation. I'm going to go in, and this is how much it can go into internal rotation. There. Yeah. Good. Now I'm going to go into the application. So just going to take few seconds again. So this is very simple. If you look on the screen, all I'm doing is just taking the discs off from the anti-static bag and applying it to different areas. In this whole process, if you see, the whole application is about just few seconds, about less than a minute, and you just apply the discs on. This is the post-test video, and this is definitely like not even 50 minutes. And you look at the reflection of how.
Yes, no.
Yeah, I know that as this was a live session at DD Goenka, so I chose this video so that you actually get to know that this is sometimes gets hard to believe, but then this really happens this quickly and
Now
really
I
does
stay a little
work.
bit here, and I can actually push a little bit more.
Yeah. So sometimes it just goes beyond an atypical range, and it's very. It's I was completely shocked when I saw it for the first time when I learned this therapy, and trust me that what you see is actually for real, and it does do that for
Yes, no.
all of your patients if you find the source of the
This is
issue.
the time you all clap.
Yeah.
I'm just getting.
Good. Okay, that was ANF therapy for you. I hope it was a great session and you guys had a lot of fun learning about it. And I'm very open to get you more information and you know how to get in touch. I'm gonna ask the organizers to put this few links into the description for you to go and have a look later, and it would be great.
Yes, sure, that will be done. Yeah. Thank you, Akshay, for this wonderful and informative session. The viewers have a few questions which I would like to request you to answer them. The first is, can the patients apply the disc on their own or self-application? Is it allowed?
Yes, so we always, it's very strongly recommended that we need to find the source of the issue first. And that comes with palpation skills. Once the palpation skills, through the palpation skills and proper assessment, we know the source of the issue. We apply the disc and plan the treatment protocols. And then on, you can always make a protocol and give the patient the discs for the further session, then they can apply it on their own. But it is always recommended that they come back for the follow-up, have a proper reassessment, and then if there's any tweaking in the treatment protocol, we do it. But if somebody cannot come, or also if we know that treatment protocol is standard now and we have to just get on with the frequencies to change and little bit, then totally recommended that we can give it to the patient and they can apply on their own.
Right. Thank you. And somebody wanted to know that where can you get the discs, or
Yes.
how is it accessible? Yes.
So I'm as Dr. Harpreet has mentioned before, I'm the founder of Health Pro Solutions. That's where my healthcare center is, and my company is actually the main distributor for ANF All India. So we import the discs in, and any therapist who's trained in ANF therapy is only eligible to take those discs. And you can just order the disc from Health Pro Solutions, and it will reach you in like a couple of, or you can just coming to the center and take it hand to hand also. So it's very easy.
Right. Thank you. And finally, some people wanted to know what are the contraindications? Like, is an open wound a contraindication, a metal implant a contraindication, or oncology patient, for the sake, are they contraindicated when they are on chemotherapy or radiotherapy?
Yes, of course. So as we go into more detailed of different different categories of levels of ANF. And as we grow into more organ functions where we try and make our therapists learn about chemotherapy and all other antioxidants which they should not use and all. But there is no contraindications except that you should not walk into an X-ray or an MRI machine with the discs on, because that can interfere with the frequency of the machine and the disc itself. So if you want to use an X-ray or an MRI machine, you can always remove the discs, go into the machine, use the X-ray or an MRI, whatever you want, come back and then reapply the discs on. So this is one of the major contraindications, that you should not walk into X-ray or an MRI. Metal implant is not a contraindication, so you can still apply on, because the nervous system, the neurons are still there, and that's where the inflammation is spreading through. So you can always apply disc with metal implants. And even so, after surgeries of TKR and you want to increase range, and what I showed you just for as a video and shoulder, imagine of what you can do with the discs to help those clients. Yeah. Open wound is definitely, you cannot put them right on the open wound, but you can always use the discs around the area to remove pain and inflammation. And if you go into different videos and information about ANF, you will know that it helps into healing scar tissues also. It helps into acute wounds also. And just for the viewers, if you want to go more into details, you can go onto my website, healthprosolutions.in, and you can look at some testimonials. It is also available on my Instagram handle, which is Akshay Health Pro. And if you go there, and you will find a little bit more testimonials on ANF stuff. And you have my details anyway, so you feel free to contact, and I will give you more details and anything you would want to know.
Okay. Thank you so much, Akshay, for being with us and sharing this information with all the rehab therapists. And I hope that we come back again with more information. Thank you for being with us. Thank you.